Question number 1.
Byron was scheduled for hemodialysis. Which of the following drugs should be withheld before this procedure? A. Insulin. B. Phosphate binders. C. Antibiotics. D. Cardiac glycosides. The correct answer is letter D. Cardiac glycosides. Cardiac glycosides are a class of organic compounds that increase the output force of the heart and increase its rate of contractions. Example of this drug is lanoxin. Hypokalemia is one of the electrolyte shifts that occur during dialysis, making the client at risk for arrhythmias. Therefore, all cardiac drugs that would put the patient at risk would be on hold.
Question number 2.
Brian was diagnosed with chronic renal failure and told she must undergo hemodialysis. Which of the following instructions would be included as part of nurse-client teaching? A. Follow a high potassium diet. B. Strictly follow the hemodialysis schedule. C. There will be a few changes in your lifestyle. D. Use alcohol on the skin and clean it due to integumentary changes. The correct answer is letter B. Strictly follow the hemodialysis schedule. To prevent life-threatening complications, the client must follow the dialysis schedule. Compliance in hemodialysis patients is most often measured by monitoring levels of blood urea, nitrogen, potassium, phosphorus, and by observing the amount of weight gain between dialysis treatments.
Question number 3.
Mark, who is undergoing hemodialysis, becomes restless and tells you he has a headache and feels nauseous. What complication do you suspect? A. Air embolism. B. Disequilibrium syndrome. C. Infection. D. Acute hemolysis. The correct answer is letter B. Disequilibrium syndrome. This happens when rapid reduction in urea, sodium, and other solutes from the blood. This can lead to cerebral edema and increased intracranial pressure. Signs and symptoms include headache, nausea, restlessness, vomiting, confusion, twitching, and seizures.
Question number 4.
Mark is complaining of muscle cramps while undergoing hemodialysis. Which intervention should Nurse Mimi perform to effectively relieve muscle cramps caused by hemodialysis? A. Increase the rate of dialysis. B. Infuse normal saline solution. C. Administer a 5% dextrose solution. D. Encourage active range of motion exercises. The correct answer is letter B. Infuse normal saline solution. Muscle cramps occur when the sodium and water are removed too quickly during dialysis. Therefore, treatment includes administering normal saline or hypertonic normal saline solution to lessen the effect of extracellular fluid and toxic filtration.
Question number 5.
Brian underwent hemodialysis via arteriovenous fistula in the left arm. Which intervention do you include in his plan of care after the hemodialysis is done? A. Apply pressure to the needle site upon discontinuing hemodialysis with gauze pad. B. Keep the head of the bed elevated 45 degrees. C. Place the left arm on an arm board for at least 30 minutes. D. Keep the left positioned above the head to prevent backflow of blood. The correct answer is letter A. Apply pressure to the needle site upon discontinuing hemodialysis until all the bleeding has stopped. Bleeding may continue for 10 minutes in some patients. Other interventions mentioned are not necessary post-hemodialysis procedure.
Question number 6.
Mark, who was diagnosed with renal failure, was prescribed with polystyrene sulfonate, Kxalate. She asked Nurse Mimi how does the medication function helps with his condition. A. The medication corrects acidosis. B. Reduce serum phosphate levels. C. It prevents hyperkalemia. D. It prevents hypernatremia. The correct answer is letter C. It prevents hyperkalemia. In renal failure, patients become hyperkalemic because they can't excrete potassium in the urine. To easily remember this, the medication given is polystyrene sulfonate, brand name K-exolate, which means K, the chemical symbol for potassium, plus exit, meaning it helps exit potassium in the bowel.
Question number 7.
Michael with chronic renal failure has an indwelling catheter for peritoneal dialysis in the abdomen. He accidentally spills water on the catheter dressing while bathing. The nurse should immediately A. Change the dressing. B. Reinforce the dressing. C. Flush the peritoneal dialysis catheter. D. Scrub the catheter with povidone iodine. The correct answer is letter A. Change the dressing. Clients with peritoneal dialysis catheters are at high risk for infection. A dressing that is wet is a conduit for bacteria to reach the catheter insertion site. The nurse assures that the dressing is kept dry at all times because a moist environment promotes bacterial growth.
How many correct answers did you get? I know you got it all correctly, but wait, don't forget to hit on subscribe button and turn on notification bell so that you will be notified for upcoming videos. You can also share this to your friends. Goodbye.